All right. So, um, we are a day late. So if you were expecting a video yesterday or a Facebook Live on a topic, I apologize. Was pretty busy, didn't get home till late. So we're doing it today, and we're going to be talking about a pretty popular topic, IT band pain syndrome. What is it? Who has it? What do you do about it? If you do have it, how do you treat it? These are things that we're going to be going over. And so if you have any questions, again, don't hesitate to put them in the comments below. If you find this helpful, or if you can hear me, please give me a like, thumbs up, just so that I know that you can hear me. I don't have a microphone on right now, so hopefully the sound is all good. So we're going to have a special guest here too as well. She's going to make her debut on the big screen in front of all of you to play a little bit of a patient, a little dummy, but she really does have this issue going on. So IT band, what is it? So an IT band, the IT band, it's the biggest tendon in the body, and it goes from the side of your hip, I'll show you right here, side of the hip here, all the way down the knee, and it attaches from the ilium to the tibia, hence IT band. It attaches the glutes, a little bit of TFL or tensor fasciae lata, all the way down below the knee there. And so there's some different theories as to what causes IT band pain, but what ends up happening is typically it's repetitive micro trauma at the outside of the knee. So the lateral portion of the knee is where these people experience pain. And so a lot of this can affect a lot of runners, endurance athletes, bikers can get these symptoms. And so they get this lateral knee pain. A lot of people will explain and say, you hear everyone talking about their IT band being tight, but what does all that really mean? So a couple things. So with IT band pain, like I said, it's typically repetitive microtrauma to that area, causing irritation or inflammation at the IT band, distally, and so there can be a number of things going on. So while it may seem like it's pain at the outside of the knee, a lot of times, again, that pain is coming from somewhere else. So more often than not, it's going to be coming from the hip or the ankle. The hip and the ankle are typically more complex. There's more going on. So if you have limited mobility there, mobility deficits or strength deficits at the hip or the ankle, that can cause some issues with the knee, because now your knee is going to, as I explained to a lot of people, ends up taking a lot of the force. And so with runners, for example, if you don't have a good pelvic stability or good core stability, your knee, if you end up valgusing quite a bit, or where your knee goes inwards, that can cause some issues there. And so that's usually what I find a lot of times with my runners, and as well as what the research shows is a lot of it's more often than not a hip issue. So that's really one of the big myths that I teach people about is, what it is, where it's coming from. And because a lot of people's go-to is stretching out their IT band or foam rolling it. We got a foam roller right here. We're going to have Jess demo that just so you can see how that's done. But that can help with some short-term pain relief a little bit, and it can be beneficial. However, where you're going to find the most benefit is through strengthening those hips, typically, if that's where your issue is coming from. And also focusing on the mechanics and the cause of it. So if your cadence is off, if you're a runner, for example, or you need to change your footwear, or where you strike and hit the ground, are you a heel striker, are you midfoot? All of those can play a factor as well. So these are some just generalities that we're going to go over. So we're going to bring Jess in right now to show you guys some treatment techniques and what you can use at home maybe to help treat your own IT band. Okay, so Jess is going to explain what is going on with her hip, and we will go from there. So that way I know kind of what to target here. So go ahead and you can tell everyone what you got going on.
So I went for a run yesterday, first time in a long time, and the side of my leg, starting here and down here, is pretty flared up. So I asked Eric for some advice and exercises and what I can do to relieve the pain that I'm feeling right now, and the soreness.
Okay, and how far did you go?
I didn't go very far.
So I'm not trying to call her out, but I like to get a good general history, so we'll leave it out. It was her first run of the year. She's not much of a runner, so to speak. She likes to get out occasionally. But it's likely a little bit of mechanics issues, as well as so looking really at mechanics and strengthening her not being used to running. So that can all play a role, as well as uneven ground. So we're going to take a look here. Which side is it?
It's on my left side.
And can you point to where you get the pain?
The worst is right here. I mean, I feel it all on this side, but right here is the worst.
Okay. So again, people with IT band pain can get it right to, I'm going to point the camera down a little, right to here. A lot of times that's where that IT band is going to insert. And if you feel on yourself, you can feel where that IT band is. It's pretty thick and tender. And she's jumping a little bit right now as I'm poking this. She's really jumping. So it's definitely a little irritated. So go ahead and lay on this side. So we're just going through, again, a quick assessment. Typically with my patients, I'm spending a lot more time asking questions and evaluating, but we're doing this for time's sake. And normally I don't have a dog in the way. So this is Porter, and if you want a dog, he might be up for adoption. Go ahead and look on your side. All right. So here's what we're going to do. We might have to lock the dog up. So, okay, Porter, you get out of here. Go, sit. So, I typically would put a pillow between, and I can even do some soft tissue work here just to get this all calmed down. A lot of times there's some issues right in here, right in that glute med. You can get some referral pain from there down to the knee. So I would a lot of times do some soft tissue work right there, working that. I'm going to show you how to use the foam roller. So a lot of people know how to foam roll, but in case you don't, here's one way to do it. And again, the foam roll is just a short-term solution. It is not going to fix all of your problems. So if you're having IT band issues, yes, this can help in the short term. If this is all you do, though, it's not going to go away. So I cannot stress that enough. Go ahead, and we're going to have you lay on your side. So she's going to end up rolling from the hip all the way down to the knee on the side here. And Porter hopefully will watch. So she's putting it right there. She's getting up a little high, and then she's going to use this leg and her arms to bring it all the way down to the knee. And she's going to focus in on some of those tender spots. And really she can roll. So go ahead and roll to the front a little bit, just. There you go. And so the IT band is very wide, so she can really roll forward, roll back. So hit the anterior part of it, the posterior part, so the front or the back of the IT band, the middle. And so this is a good way to just massage, do some self-massage and some self-myofascial release on your own body and muscles. So you can do this with hamstrings, quads, just sit in the outer portion. So a little bit of IT band, a little bit of vastus lateralis, some of those quads there. All right, good. And so she can do this really for anywhere from couple minutes, 5 minutes max. You really don't need to spend all day doing something like this. Good. So next we're going to get into some strengthening, some of the exercises really to help build some long-term change. So a couple things that I like to do with my IT band patients, I'm going to have you lay on your back. I'm going to go through 3 exercises that are really good for this and really good at helping to improve some strength here. So one of the first ones is a bridge, and how I like to switch this up a little bit is make it a single leg bridge. The reason I like to make it a single leg bridge is it is going to target her gluteus medius a little bit more, be a little bit more challenging on the hamstrings, add in a little bit of a rotational component so the core has to stabilize that pelvis. So you're going to put your unaffected leg up. So it was her left leg, that leg's down. Her thighs are parallel, these two. And she's going to lift her butt up. So squeeze your butt, lift your butt up, 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 a little higher. She's rotating this way a little bit. We want to make sure that's level right there. Pause and then down. And we're going to go, let's do 10 of those. So a lot of times I'll start people off with 1 to 2 sets of 10 just to make sure that it's appropriate. If you find that that is easy, you can go to sets of 15 or more and typically doing multiple sets. So anywhere from really 2 to 4 sets. Good. And if you notice she's lifting this leg up, we really want to keep the thighs level because now I don't want her cheating and flinging that hip up and using momentum. So really lift up, keep parallel.
I already did 10.
You did 10. Okay, let's do a good one though. And my other rule of thumb, I'm not going to do this to Jess, but for every wrong rep, you got to do 3 good reps. So, okay, you don't have to do that. All right, you're good. Okay, so she did some good reps there at the end. Those all look great. So, next what we can do is we can do a side plank, and that's really going to work on some core stability. So Jess right now gave me a look because she does not like that idea because it's pretty challenging movement. So we're just going to get into a side plank. So can you show me that? And we're going to do both sides when we do the side plank. We really want to focus on both. So I'm going to show a modified version. If you're not able to do a full side plank, this can be a very challenging movement. So a lot of times I'll simply start, we're going to put the elbow under the shoulder here. And we're going to stack the knees just like this. And now she's going to go up into the plank position. And I want to keep a straight line from the shoulders down to the knee. And you can hold this for 15 to 30 seconds. If you find that's easy and you want to go to a full minute, you can. And then we'll end up relaxing and going down. Typically doing about 2 sets of that. The other way, so now to make it more difficult and do a traditional plank, we're going to straighten these knees out. Okay, and so the knees are straight. I want a straight line from her shoulder, hips, knees, ankles, all in line. I don't want any rotation of the trunk I'm looking for, so go ahead and go up. Good, just like that. I'm also looking down at her knees and her shins, making sure there's no tibial drop. Porter's making sure that she's doing a great job and making sure making sure she really sticks that plank. So if you have a dog like Porter, that can really help you hold that. That'll probably cost you extra, but in all seriousness, straight line, shoulders, hips, knees, ankles, you want to be doing that. So those are 2 exercises right there that are excellent. The next exercise that I'm going to give are simply some clamshell exercises. Very basic, yet can be effective exercise here, especially if you're lacking some hip mobility for external rotation as well as some strength. We're going to keep the heels together right here. Knees are bent. Okay, heels are in line with her butt. She's going to lift up. Now, how I see people do this wrong all the time, pretty frequently, is rotating through the pelvis. I do not want to see rotating back to get that leg up. You want to keep, I usually tell people, hand on the hip here, so that way you can feel if your pelvis is moving. Go ahead and lift up. And she does an excellent job of keeping everything stable right there. And so with these, really, you can probably rep out full range of motion, anywhere from 20 to 30 reps. And then I would do both sides as well. I'd make sure you're doing both sides. Alex, your number one biggest enemy. I hope you're talking about your IT band pain and not Jess or the dog. If my dog is Jay Stewart is your enemy, let me know. I'll take care of it, and hopefully that's not the case. So yeah, if you guys have questions, don't hesitate to put them in the comments below. Thank you so much, Jess, for. Jess has a question, so I'm being put on the spot here.
Does hyperextending your knees while running, can that affect your IT band or cause issues?
So she said, does hyperextending your knees while running, can that cause IT band issues? Hyperextension of the knees can definitely cause some issues. I wouldn't necessarily say there definitely could be a relation with IT band pain and hyperextension of the knees, simply because if you're fully hyperextending your knee, you're likely not relying so much on your muscles and you're relying a lot more on passive structures such as IT bands, some ligaments, that kind of thing. So I would say that definitely can play a role. One of the best things that I found, honestly, with running is looking at your cadence. You really, I tell people, or my runners, and to be between 165 and 180 steps per minute. So you can download a simple metronome, put that on your phone, set the metronome, typically to about 170. It should be an increase in about 10% of your cadence if your cadence is a little slow. So it shouldn't be any more than 10%. It shouldn't feel like you're really stepping way too fast, but it should feel like a little increase there. And Jenny, thank you. Yeah, I agree. My assistant / model today was pretty good looking, so appreciate the feedback there. Thanks for watching. So that involves, I'm gonna lift this up. She's out of here. So yeah, absolutely, hyperextension could play a little bit of a role there as far as IT band pain. So if you're having IT band pain or specific questions regarding your injury, please put them in the comments below. I'm more than happy to answer them for you. I apologize if Porter got in the way today. He was only trying to help. He thinks he's a great assistant too, and now it looks like he's going to take a nap. So thanks so much for watching. You guys enjoy the rest of your Tuesday night, and I will be putting out some more info here shortly, so stay on the lookout for all of that. And thank you so much, everyone, if you've given me feedback. I've had a bunch of you reach out to me and give me some different feedback, so I greatly appreciate it. Thank you so much. So my dad can't see my mouth. I don't know what that means. I'm sorry, Dad. I'll try and fix that. So thanks everyone for watching. You have a good night.